So Jamaica's COVID-19 cases have surpassed the 20,000 mark, with positive cases almost reaching 500 in a 24-hour period. This has caused more persons to be admitted to hospital, causing a strain on our hospitals. Truth be told, the last couple of days I've noticed it's been under a couple hundred, which is good news, because before that we were seeing 300, 400, so that's great news, but it's still too much. So join us now with an update on what's happening is President of the Medical Association of Jamaica, Dr. Andrew Manning. Dr. Manning, morning and welcome, sir.
Morning to you, and good morning to your viewers. Morning, Taylor.
How bad is it now, sir?
We're at
Hospital
a
space.
critical. We are at a critical juncture. It is very bad. The hospitals, certainly the major hospitals, are full, and what we're doing is trying or using contingency measures to free up a bit more of the beds, and we are trying to get the field hospitals on stream. But the situation is bad. We have to cut down on the surge in new cases. As you said, we if we continue at this rate, we will reach a point where we can't admit patients to the hospitals.
Yeah. We can't admit patients, period, or COVID-19 patients.
Period at this point, because we're taking, you can't really just speak about a COVID bed now. You're really adjusting things now to deal with COVID. But the fact of the matter is, the bed space in general is limited, and people in the public need to understand this in terms of how we behave, because we have to follow the guidelines to slow down the spread, to flatten the curve. We need to keep doing that, and especially at this point in time.
Speak to me about the field hospitals. Where are they now, and what is a field hospital?
All right, so a field hospital really is generally temporary facility that some of them are designed to be used as is, like you can just ship it down and set it up at a point. You just need to make sure you have adequate power, water, oxygen supplies, and so on, and you put beds in it. But essentially, you set up a place where you can house patients, treat them outside of the already established hospital settings. So some are already made, but you can set up field hospitals in other locations, in a large space where you can house patients safely. So they're generally designed to be temporary, and I believe that the 3 field hospitals that they're trying to set up should increase our bed capacity by over 100. In terms of the status, I'm not sure. We have to wait and hear from the Ministry of Health, read that. But they had decided to move one that was at National Chest Hospital to St. Catherine to help them out in that location, and there's going to be one out west.
Doc, a lot of times when we talk about the impact, we go infrastructural. I mean, now we're talking about beds, we're talking about space, but what has the impact been on hospital personnel?
Severe or significant, because, you as a doctor or a nurse, you are also at risk. In fact, you're at higher risk of contracting COVID-19. So you would have seen in the press recently, certainly in Mandeville, episodes of a lot of the healthcare workers going out. For full disclosure, I work at Mandeville. I'm a consultant at Mandeville Regional Hospital. And so we have actually had to scale back services in operating theater, for example, because a significant number of the staff have gone off and have had to be in quarantine, some in isolation. And so you have that aspect. When the healthcare workers get ill, you don't have people on the front line who would be required to care for the patients. And also we're under stress. All of us are under stress, because you go to work and everybody has in the back of their mind whether or not you're going to catch COVID. So the impact is significant.
Yeah, I was about to say, a lot of what we hear is if you have a comorbidity, it makes you more vulnerable. And I suspect that a lot of people heading to hospital in their mind, they're thinking, oh, I'm going to hospital because I have a comorbidity. Am I increasing my vulnerability by coming there? With the capacity as it is, how effectively have you been able to isolate COVID patients from the other patients that come to hospital?
Well, from early on, specific isolation wards and units were set up with strict measures in place to keep persons separate. But one of the problems arising now is that you will have people coming into hospitals for other reasons not related to COVID, and they're asymptomatic with respect to COVID, but then their test comes back positive. It's one of the things with the phase of community spread that you have to assume that anybody that you interact with has COVID. I have to assume when I go out there that I have COVID. So I have to, and all of us have to wear the mask and take adequate precautions. So that aspect has been a challenge. So far, we have been doing well, but in recent days with the surge, you would have had the risk of persons who have had COVID coming into the hospitals and you don't know about it, both on the wards and in the clinic settings. And the thing is, we've been trying to mitigate against that, especially in the clinic settings, in terms of trying to schedule persons for their appointment, which really isn't a cultural thing from a Jamaican point of view, but we're
Yeah.
trying to do it. We're trying to limit the numbers of persons in the waiting areas at any one period of time. And well, the minister had announced, I believe it was yesterday or day before, that they're asking persons not to go to the hospitals unless it is absolutely necessary.
Yep. Dr. Manning, let's speak quickly about the vaccine. And I know there's a criteria set out on who can get it, who will get it when it comes. Can you tell me how quickly the start will be? And are there anyone out there who should not get the vaccine? I'm not talking about people who don't want the vaccine. Without daily use the word comorbidity, is there anyone out there that should not set themselves up to take this vaccination?
Well, firstly, in terms of the start date, we're not sure. It was announced by the Minister of Health that we should or are anticipating getting our first set of vaccines by the end of February, which is maybe 3 days from now.
Yep.
So we're anticipating that.
Okay.
All right, that is a plan, and things are being put in place to prepare for that. In terms of who will be getting it in the first set, certainly the healthcare workers.
Yep.
And persons who are elderly.
Yep.
All right, because those groups are actually at highest risk. In terms of who should not get the vaccine, if you have had a previous allergic reaction to a vaccine, all right, we're recommending that you not get it. Currently, if you're under 17 years of age, you shouldn't get it, and that's because the studies haven't been done on these persons. All right.
Okay.
There is pregnant women. The initial studies were not done on pregnant women, but the thoughts now are that if you have pregnant women who are at high risk for contracting COVID or succumbing to it, perhaps they should take it. So if you're pregnant, discuss with your doctor, all right? And in fact, anybody wanting to get the vaccine, if you have doubts, talk with your doctor, because those groups that I mentioned certainly should not get it.
Yeah. And final
There
question.
may be others. Sorry?
As well.
And final question from me, sir.
Yes.
How do you protect those people who should not get the vaccine from getting the virus?
You have to keep them, the same measures that we're taking now. All right? The measures are onerous, but they actually work. Stay at home if you don't have to leave your home. If you have to go out, wear your mask, wear the mask properly, cover your nose with the mask, cover your chin, use hand sanitizer meticulously. I walk with this, right? Every time you touch something, you wash, you wipe, use a hand sanitizer. Don't touch the front of your mask, avoid crowds. By the way, you guys are 6 feet apart.
Just about, yep.
All right. So measures like that, they seem onerous, but they work. Don't have any illegal parties, illegal gatherings, or anything like that. Those measures are there to protect you. And then other than that, we have to try and develop herd immunity
Yep.
so that we will reach to a point where the virus, we're able to stop transmission of the virus within society.
Okay.
But until such time, we have to continue with the measures that are stated.
Thank you,
All
sir.
right. Thank you so
And I
much, sir.
thank you, sir, and your colleagues for, as I've said many times, risking your lives to save ours. I really appreciate that, what you guys are doing. So stay safe, sir, you and your family. God bless you.
You stay safe, and thanks for spreading the word.
Yeah, man. Dr. Andrew Manning, President of the Medical Association of Jamaica.
All right. She's been managing her academics very well and even copped a few scholarships. Up next, we'll have a chat with UWI student Christina Perkins. Stay with us.